I'm from South City, but I travel all the way here because I usually travel to Trader Joe's here. It doesn't have as many organic food as Whole Foods. So even the price is a little bit higher, but we prefer that money cannot buy good health.
Shopping at this store is far more convenient because of the price factor of $1. Now, going to other stores, getting the same items will run you as high as $5 and $6, and in certain cases where I go to was as high as $25. But here, I can keep the price factor down to at least $10.
You know, the place that I'm living right now, it's too far for me to buy food, and I just take the bus, and we just walk for maybe 15 minutes you walk.
Access and availability of wholesome, nutritious food is important for people of all ages for well-being, especially among older adults, as they are at risk of experiencing additional challenges that impact their access and ability to eat healthy food, such as poor health, immobility, and other factors such as decreased income and food insecurity.
Together with our colleagues at the Healthy Aging Research and Technology Solutions Lab at the Stanford Prevention Research Center, which is a part of the Stanford University School of Medicine, we've developed the Stanford Healthy Neighborhood Discovery Tool. This is a mobile application that allows community residents or citizen scientists to gather information about their neighborhood and the features therein that affect their ability to make healthy choices.
The Discovery Tool is an easy-to-use, computerized, tablet-based mobile app.
The Discovery Tool has been primarily used to examine neighborhood environments for walkability. The Get Healthy San Mateo County Initiative supported the Healthy Aging Research and Technology Solutions Lab to move the Discovery Tool in a new direction in the FEAST project.
The aim of FEAST was to test the feasibility of using the Discovery Tool to explore the neighborhood food environments in North San Mateo County, California.
We sought to identify and better understand barriers and facilitators facing older adults in accessing, choosing, and buying healthful foods. 23 residents or citizen scientists from San Bruno, South San Francisco, and Daly City in California participated in the FEAST project. Along with a researcher, each citizen scientist visited the food store they most frequently go to purchase their food. Some citizen scientists traveled 1 block or 1 mile. Some traveled on foot, in a car, or on public transportation to shop, and others traveled to cities nearby and afar. While walking through the store, each citizen scientist used the Discovery Tool to identify and speak about factors that helped or hindered their ability to access, choose, and buy healthful foods. Altogether, over 600 audio narratives and photos were collected with the Discovery Tool by our FEAST citizen scientists.
The FEAST citizen scientists were invited to a meeting where they viewed the photos and bilingual transcriptions of the audio narratives organized by theme. Grouped by city, they discussed and voted on the most important yet feasible issues affecting their ability to eat healthfully.
My number one challenge, I will say, will be the distance, the mobility. For instance, when I had my knee replaced, it was very hard for me to move around, especially that they remove a route from, they used to pick us up here at Rotary Plaza. They did away with that. We don't have it any longer. So we have to walk all the way down to El Camino Real. And if somebody has a cane or handicap, it's very hard to go all the way down.
After the meeting, they were trained in skills and strategies necessary to be an effective advocate for themselves and their respective communities. Citizen scientists living in Daly City voted on access to affordable, healthy food and transportation, whereas transportation had the most votes for South San Francisco residents. A second FEAST community meeting was held at Lincoln Community Center. In addition to FEAST researchers and citizen scientists sharing information about the project and the needs of their communities, the purpose of this meeting was also to connect North San Mateo County residents with public and private sector organizations and agencies that could potentially work with them to address issues related to their accessing healthy foods. FEAST was a community-based participatory research project that demonstrated an integrative approach to research, policy, and practice. We sought out to work with older adults in North San Mateo County and help them use technology to identify challenges that they experienced when accessing, buying, and choosing healthy foods. FEAST citizen scientists were trained in advocacy and presentation skills, were connected with local decision and policymakers, and were provided with a forum where they could present their priority issues.
Cost and transportation were the two major issues that were barriers to accessing healthy food, and many of the same issues resonated across cities and among various racial and ethnic groups. Our research team at the Healthy Aging Research and Technology Solutions Lab has a history of working with communities in the San Francisco Bay Area, nationally and abroad to effect policies that support healthy active living.
We assess, promote, and advocate for healthy communities using innovative, state-of-the-science methods, and will continue our efforts towards achieving healthy individuals and communities.
Estoy muy proud y muy orgullosa de que pude ser parte de él. En gracias a este proyecto y por favor que sigan haciendo más, no nada más de food, de muchas cosas más, porque también somos seniors, pero también somos personas y también nuestra voz cuenta. Gracias.